We're creating the AI operating system for advanced therapies. Within the first week or two, we started to see that volume starting to build. These were exactly the patients we're trying to reach. Our Google cost per lead, was coming down. When the campaigns went live, we saw it happen pretty quickly. The ads are really speaking to our target audience, and we were seeing good conversion coming into the platform. It was genuine relief. It was sheer joy. So our experience working with Rovia has been fantastic. What we're building here is a scalable marketing acquisition engine. We're excited about the traction that we're seeing.
Chris, tell me about yourself and what you're building with Genoplex and Therapy for Me.
Well, Harsh, I've spent over 20 years in the biopharmaceutical industry, first as a molecular biologist at Amgen and then at other biotech and pharmaceutical companies. And one of the things that I kept seeing over and over again as I've launched products into the US and globally is that we've got these innovative, extraordinary therapies, and we find that patients just simply couldn't get access to them. And so the infrastructure to connect these patients to treatment centers doesn't exist. And that's what we're building at Genoplex. We're creating that AI operating system for advanced therapies. Therapy for Me is a patient-facing platform. It's how patients with serious conditions find access to specialists at treatment centers across the US.
Just to jump into this, what's currently broken and how patients are finding these therapies at the moment?
What's broken currently in the system is that we have a legacy healthcare system that is based on a pill-based delivery model, not built around precision therapies where, for example, your own cells, your own stem cells and immune cells are often the starting material for your healing journey. You have to think of these personalized medicines as living drugs. So, for example, if you're a lymphoma patient, you might have failed multiple different drugs, older drugs, and even chemotherapies, and you might be a candidate for cell therapy. But for many of these patients, they're stuck and they may not learn about it, or even their healthcare providers may not know about it. And so sometimes it's just too late for them and they never get a chance to even get these drugs.
Good to hear. And Chris, before working with our agency, what was the biggest challenge you had in getting qualified patients into your platform?
Well, like many startups, I think the biggest challenge for when you build a novel tech platform is awareness of the platform and bringing users into the platform. I mean, it's the classic kind of go-to-market challenge, and so that lack of awareness and consistency was our core problem before we started working with you. And we've had spikes and then dead periods in our platform, and so the challenge with launching these new tech apps is just improving that awareness. We're really looking to supercharge the system and kind of move patients into our platform so that we become a trusted source of knowledge for advanced therapies, and that patients feel comfortable coming into the platform and connecting with specialists who can help them with their healthcare journeys.
Got it. And how long has it been since you've been working on this platform?
Well, we launched the platform a little over a year ago. So we're happy to say that we're seeing strong results, with the platform. We're seeing good, qualified patients. It's growing month over month, and so we're excited about the traction that we're seeing.
Chris, you also had mentioned you had a team running ads previously, but they weren't really optimizing. What was and what wasn't getting done during that time?
I mean, look, the basics were getting done. So the team that I've worked with in the past, and even in my prior experience at pharma companies, the big ad agencies, they spend weeks and months with a brief, coming up with all of these iterations, and and then you pick like the one or two ads that you like, and then you just launch them in market. And it really always drove me crazy. There was no testing. There was no utilization of AI. There was no A/B testing. Believe it or not, I hardly ever saw it up until now with the work that we're doing. I love, how can you? It's hard to know what ads are going to perform best until you test them. And so we did with the prior team. We were running ads, impressions were accumulating, but we weren't seeing conversions. We weren't optimizing the creative. We just ran them. There was. So that optimization piece was missing, the testing piece was missing, and honestly, we weren't capitalizing on all of the AI tools to help generate that new ad creative.
Awesome. Yeah, part of it is getting data back from the campaigns that we run. There's no chance possible where you just launch one campaign and it works out beautifully. You have to continue to adapt. So that's part of just our process that we have in our agency to continue refining and optimizing.
Well, we're seeing that in our results, which I know we're going to talk to, right? But I mean, we're seeing the ads that I think are going to perform the best, the ones with awesome visuals, are oftentimes not the ones that perform best. So you have to test them with your core audience, and that's what's got me really excited with the work that we're doing together.
Very nice. All right, let's jump into working together. So when campaigns went live, Chris, what was the moment you had realized, okay, I have something here. This is actually going to work?
Well, it happened pretty fast, actually. So when we started working together and the campaigns went live, I noticed almost within the first week or two, we started to see we saw the metrics. We saw more patients coming into the platform, and then when we looked in the platform, they were highly qualified patients. So these were patients with cancer, with autoimmune diseases, with neurodegenerative diseases. These were exactly the patients we're trying to reach. So our Google cost per lead, was coming down, and it dropped significantly over the last couple of weeks. And I knew this wasn't luck. I think this was just, again, that creative working hard for us and all that testing. We're getting really good, that the ads are really speaking to our target audience, and we're seeing good conversion coming into the platform. So when the campaigns went live, we saw it happen pretty quickly. We saw within the first week or two, we started to see that volume starting to build.
Amazing. And then we're a health agency, so you saw us get really deep into Google, targeting specific keywords, hyper focus as well, bringing in the right type of patients. What has it been like working with a team that operates at this level of detail in the health space?
That's one of the reasons why I wanted to work with you, is because of that healthcare experience. Other agencies, I feel like, have very junior talent. They haven't worked in healthcare. They don't understand the regulations and policies around that type of highly regulated content. And so, it, you know, that's what part of the appeal of working with you is. I saw having an agency that understands healthcare marketing and not just generic marketing. It was really important. Most agencies might run just a broad condition-based campaign and call it a day. But what stood out specifically was the amount of time that we took up front in the onboarding phase to really understand the problem, the customer, the branding, and our technology platform to help us achieve our goals.
Great. And then how would you describe the speed of execution and the way our team communicates with you, Chris?
I would describe the speed of execution and the way your team works with us as being fast and direct. And I love it, since I'm working and leading a tech company. I like working with other tech companies and leaders who understand how to use technology. So we have a team Slack channel where we do most of our communication, but the team's responsive. Usually oftentimes in less than an hour or even minutes, they're responding. And we have weekly touch points if we need them, and if not, less frequent. We don't have meetings for the sake of meetings, and that's what I appreciate. It's all about speed of execution, being on brief, on message, and moving quickly. And that communication style matches the pace that I operate at, and which, a founder like me, that's really valuable.
I love that. Let's get into results and impact. So within the first couple of weeks of launching, you sent us a message saying we're seeing 4 to 5 new patients entering our portal every day, most of them highly qualified. Take me back to that moment. What was going through your head when you realized this was actually working?
I'll take you back to that moment when I realized that the platform was really working, that our partnership together was really driving results and driving more qualified leads in the platform. Yeah, we saw in our first month working together, we saw over 65 patients coming into our platform. Those are not website visits, but actual users of our platform. And I think it was genuine relief. It was and sheer joy to see, because ultimately, we're a mission-driven company. We want to see patients benefit from our platform. It's free for patients to use. So it's really, we want to make sure that patients find the specialist for the care that they're looking for. So I was really pleased by the speed, the velocity, and how quickly we were able to see results, when we started working together, even in that first couple of weeks, first month together.
Nice. And now we've driven roughly near like 200 new patients in just 2 months, 4 to 5 coming in daily now. How does that compare to what you had originally expected when we first started?
Let's say the 3 to 5 patients that we're seeing today is where we were hoping to be, a few months, I would say, into our relationship working together. So seeing it already happening within the first 2 months is, I would say, exceeded expectations. I would say this was the type of volume that we were forecasting to see several months into the campaign, honestly. So we're happy with the trajectory that we're on right now, and we're just looking now to continue working with you to see that month over month growth and see those numbers, grow by 10x before end of the year.
And I know, Chris, you're chatting with investors, and those meetings sometimes get super intense. I've talked to investors myself. When they start digging through like growth and results, I know it's a little bit intense, but how does having Rovea behind you change how you can handle those meetings with the investors?
Well, it changes the whole narrative. So when we're having investor discussions and even like customer discussions, everybody wants to know the data because honestly, hyperbole and over flexing and overinflating your traction you just lose credibility. So I think having the data that you all help us generate is it changes the whole narrative. So we come into those meetings being able to say, hey, let me show you the data on our platform. And I think it also drives conviction and confidence in what our leadership team's able to deliver in such a short time because we built platform, we launched it in the market, and we have significant user volume in only 12 months since we launched product in market. So I think that's the best traction you could show a customer or an investor is the data and the evidence in the hard numbers that we're generating together really help us do that.
Yeah, one part going into those meetings is, hey, I'm forecasting blah, blah, blah to happen without having that data in place. But when you're seeing true traction, people coming in, you have the data to back it up, then you can forecast, then investors are much happier as well. And they trust you.
There's that, and there's also the repeatable, scalable engine that we're trying to build. Because as we look at the cost per leads, I don't want to diminish the importance there. It's one thing like your acquisition costs, can't be excessive. We have to be showing, and we're starting to see that, even though it's only been 2 months. We're starting to see the efficiency of our advertising and our cost per lead go down, which just speaks to the quality of the content, the ads, and that what we're building here is a scalable marketing or consumer acquisition engine.
Chris, let me ask you this one. So now having this predictable patient flow, and we're going to continue to make optimizations, scale it up even more. But what does that change for you as a founder or internally or for the team and how you think about scaling?
Well, it changes everything downstream because the truth is, as you know, with your experience in software development as well, that you're constantly iterating, evolving. Our iPhones are constantly pushing out software updates. So it changes everything downstream because now we basically now have user experience in user data. And now that we have predictable patient flow, we're able to test, optimize our platform and make enhancements because we want to now, our job now that we have volume and users is to increase our conversion rates. We don't want to see patients bouncing from the platform and say, because maybe for whatever reason, right? We want to see them continue through all the way through and connect with a specialist and get to the care they need. So having a predictable flow like we have now, it changes as we think about scaling. I start to think about, yes, bringing more volume in, but at the same time, I want to make sure that our conversion rates go up. And so we continue now to focus more downstream on optimization and driving higher conversion.
Yeah, just on that, like I've worked with over 300 companies and founders now. A lot of folks get stuck in building their product, adding new features without having a customer base there. And I've seen it numerous amount of times when people come to us. They're like, okay, we're going to launch feature 1, 2, 3, 4, 5 in the hope of getting more customers, only for them to find out when the customers come in, they actually don't need those features. They need something else completely. So it's this iterative process of building the product out while getting customers and scaling at the same time. So you're thinking about that the right way. I like it.
Yeah. No. Yeah. Thanks. Yeah. I mean, you're right. It's easy to fall into the trap of like we know best, and but also you have to be cost efficient with your burn rate and your investors' money, and you need to be able to really be clear at how you're prioritizing your technology pillars and what new features you're building in without having any user feedback. So that's good to hear.
Yeah, and one other note is if you do have a feature that you want us to test out and go to market with, you don't have to build that feature out. We can market it as a waitlist or a beta feature and see what the traction is going to be. Instead of exhausting hours and months and years building this product or feature out, only to find out no one really cares about it. So
Great point. Yep.
if another health tech founder asked whether they should work with us, what would you tell them, Chris?
Well, I'd say, look, if you're serious, if you're building a consumer-facing application and you need a team that actually understands, especially in this healthcare space, I would say, then yes, Rovia is the right partner. And to not partner with you, you're not seeing the forest through the trees. But I'd also say, come ready to move quickly and take advantage of the onboarding phase. Make sure that you're coming in and have done all of your homework, because that's a critical phase. At first, I was a little impatient. I was like, let's just get to it, right? I was eager to get, but we spent a couple weeks just making sure the team was aligned on the strategy, the mission, what the tech platform does, and what the goals are. So show up ready. But if you're in this space, if you're a founder developing technology in the healthcare industry, especially a consumer-facing application, then I would highly recommend this is the right call.
Perfect. And then in one or two sentences, Chris, how would you describe your experience working with us?
So our experience working with Rovia has been fantastic. I mean, you're helping us execute on our go-to-market strategy of the first key pillar of our go-to-market strategy, which is to raise patient awareness, consumer awareness of our tech platform, and building a sort of cost-efficient and scalable acquisition engine for our marketing efforts. We still have a long way to go, but the partnership with you is strong and it's just evolving every day.
Well, thanks for your time, Chris. Appreciate it. Have a good rest of your day.
Thanks, Harsh.